Good evening. I hope you can hear me okay. I'm Christine Collins. I'm the Executive Director of Kidney Cancer Canada. And here we are on June 1st, which is kickoff night for the month of World Kidney Cancer Day. We're so excited to invite Dr. Rob Rutledge, who hails from Halifax, Nova Scotia. And I'll give you his bio in just a second. We're going to have a talk on anxiety and a cancer diagnosis. We all know what that is like. And Dr. Rob is going to give us 7 practical ways, maybe a little more, to experience peace of mind during this difficult time. I think that you'll really enjoy it. I have had the privilege of hearing this talk before, and it was very well received. And I think everybody got a lot out of it. So I'm so glad you're here to join us, Rob.
Thank you.
And Dr. Rob Rutledge is a radiation oncologist in Halifax, Nova Scotia. He specializes in breast, prostate, and pediatric cancers, but he is a wonderful supporter of Kidney Cancer Canada, and Rob and I have worked on other projects before for kidney cancer. He's an associate professor in the Faculty of Medicine at Dalhousie, and his passion is empowering people affected by cancer, and has delivered hundreds of public talks and webinars along with 60 retreats and day-long seminars to thousands of cancer survivors. So Rob is well-versed in how to support cancer patients. He's received a Cancer Care Nova Scotia Award for Excellence in Patient Care, and Doctors Nova Scotia presented him with the Health Promotion Award in recognition of his contribution to physician health and health promotion in cancer patients. He co-leads Cancer PEP. I can't say enough about Cancer PEP. It is an excellent patient engagement program that teaches advocacy, healthy living, mindfulness. It's a great program, and it's a comprehensive 6-month daily patient empowerment program. It started in November, and is it starting again in November, Rob?
Probably in July this year.
Oh, great. Well, I know I've kind of passed it on to a few of our patients. So if you can visit cancerpep.org to learn more, or you can write us at www.kidneycancercanada.ca, and we can certainly share some more information on that. But now to why we're here, anxiety and a cancer diagnosis, and I'm going to hand it over to you, Dr. Rob. So thanks so much for joining us.
Thank you. So I will share my screen here and get us going. Thanks a lot, Christine, for that lovely introduction. And I'm always really inspired by people who will take the time to join us live or to watch this video after the fact. I think it sends that meta message that you can empower yourself. You can make a real difference in your health and your happiness. And there are ways, and I think especially within kidney cancer, I think about the new therapies that are coming forward. I think that oftentimes there's therapies that boost immune function. And if you can empower yourself and have less anxiety, then I think those medications can work better. And I just think you'll be happier and healthier if you kind of learn what you can do to kind of make a difference in your life. So hats off to all of you for joining us right now. And it's always great to work with Kidney Cancer Canada. So thank you. So it's more peace of mind, because I don't believe that we're going to kind of come into a completely peaceful state. From my perspective, what I've seen within my own life and within others is that we have this kind of, some days we're feeling more anxious, other days less so, maybe by the hour, depending on what's happening. This is kind of wavering effect. And one of the teachings is not to fight against those days and moments when you are feeling more anxious. It's a paradox that if you can accept, this is just how I'm feeling right now, it actually will lower your anxiety levels, boost your immune function, and so on. And so there are practical things I want you to walk away from, but also just that whole philosophy, just a little bit more like let be, let go, do the things you can do, and then kind of let go of the rest. And it really, paradoxically, you'll be stronger both physically and psychologically. So I'm excited. I really like this piece because you can make a huge difference there. So I basically said the same thing. It's normal to feel anxious, right? And we can use that energy to empower ourselves, both within the medical system and what you can do on the day-to-day to get stronger and have better immune function. I also want to just say, look, there are things we can control, there are things that we can't. When you focus your energy on the things you can control, including your relationships and what's most important to you, when your life force energy is there, it's harder to be anxious and fearful about the future. It's like you're living your life completely. And that's one of the principles of acceptance and commitment therapy that we'll be talking about. And paradoxically, the kindness towards yourself is the best mechanism of making a psychological shift. So instead of kind of beating up on yourself, oh, I'm not doing this right, I'm too scared, I'm too anxious, my immune system is not working well. It's like, okay, relax. It's all right. This is what humans go through when they get a kidney cancer diagnosis. And again, paradoxically, that kind of acceptance piece will allow you to get better and stronger. So ultimately, you can work with this. You have the resilience within you. And like any point on the cancer journey that I've seen at any one of my patients, the resilience kind of comes up to meet the situation, right? And so if you understand that and that you practice that, you change that perspective, you actually will get physically stronger, or at least maximize your physical capacity and psychologically happier. Okay, so I'm also trying to put this within a bigger context, right? What do you want? Like, why are you listening to this seminar? And after a kidney cancer diagnosis, people want to maximize their recovery, maximize their chance of cure, or if they're not going to be cured, they want to maximize their longevity. And everything that I'm talking about tonight is going to go after these goals. Like we're pursuing this. Paradoxically, yes, we want to experience more positive emotions. We want to feel happier, more at peace, et cetera, by allowing yourself just to be yourself, allowing those anxious feelings simply to be there. We want to function better. So this is the one that I kind of understood as well, is that when you are in that better state, when you are stronger physically and psychologically, then it actually allows you to do the things you want to do. Like, what is this life all about anyways? It's about doing the things, connecting with the people, functioning better, thinking more clearly so we can do all that stuff. And so again, it's one big holographic package of like everything that you do to empower yourself helps in all the other realms. It's like one big piece of pie. So ultimately, you're leading a more meaningful life, however that is for you, right? So you're taking this opportunity of a cancer diagnosis and saying, no, I'm going to reprioritize. I'm going to figure out how I can change and heal and grow from this and be a better person and spend my time in more meaningful ways. So there it is. There's opportunity. We start fresh every day, every moment. It's like, okay, now what? How am I going to approach this circumstance? Can I let my love out, let my spirit out in this circumstance? And so I ultimately think for most people, it is really around connection. And yes, connecting with other people, connecting with oneself, connecting with life. And then I will also say I like this idea of kind of reframing. So no matter what circumstance you're in, you can say, I can grow from this. I can get stronger psychologically. Physically, you might, take a hit, but psychologically, spiritually, you can grow. You can kind of make a kind of expansion of your perspective as opposed to a contraction and a narrowing of the perspective. So how are we going to do this today in the 45, 50 minutes that we'll create this talk? So you can see what I'm setting out here. I think about kind of anxiety in kind of three levels. I want to talk about kind of have you kind of put this together. One is, what do you do when you're scared, you're upset, you're flustered, you're stressed, right? So, that's not a good state to be in. You're not going to get back to perfect, but you can settle yourself down. So the sudden stresses. The second one is, how do you change your baseline? I call it the stressometer, right? Are you like walking around in this world kind of anxious and stressed and flustered and your stress meter is like really high? Or can you actually settle, become more centered, peaceful, calm, clear thinking, same external environment, same challenges, same people, same circumstances, but you're in this space and that you're making better decisions because of it and you're functioning better because of it, right? So there's what I call with second level is like resetting it down into a more clear, positive way of being. The third level is to actually reframe the whole darn thing to recognize that this is just life. This is just life force energy. This is just perception, and that there doesn't have to be a struggle against anxiety. It doesn't have to be a struggle against the difficult emotions. It's just like, no, this is the flow of life. And then we get into that space and you kind of come back home to the current moment. Life becomes a lot easier. And one of the things as I was preparing for this talk, I wanted you to think about when you get anxious. Often people ask the question, like, why? Like, why am I anxious? Why is this happening? And that has its place. Like, we're going to psychologically figure this out, look for the habit loops. It has its place. But I actually want to ask you a different question. It's what? What are you experiencing right now? Right? So you're in the midst of anxiety. Something's triggered you. Instead of like pursuing it and catastrophizing and letting the mind games kind of control this, become very curious. And even right now, so I'm going to try to practice this with you throughout this talk. Even right now, what are you feeling? Turn the spotlight inwards, what they call introception. What does it feel like in your body right now? So not the thinking part, but the what is happening? How do I feel? Where's the energy? What do I feel in my heart area? What do I feel in my throat? What do I feel in my head? Can you differentiate a left side of your body? So if you're feeling anxious between you, right? Is there a difference in the anxiety between the two sides? Is there a difference in your body between the front and the back of your body? Right? You're now in curiosity phase, and that's a different feel. It's actually an energized feel, even in the midst of anxiety, kind of panicky feelings like, what is happening? Not why is it happening? What is happening? Curious. That's a bigger reward. And if you can stay with your anxiety through that, oh, what is happening? What does this feel like? Where is this? You'll see that there's a kind of a pattern to the anxiety. And typically, if you can let go of the thinking mind will drive your physiology, the chemicals, for about 90 seconds. And if you keep on thinking the negative stuff, it keeps on driving it. But if you can let go of that thinking and stuff and watch carefully, even right now, you can actually, it dissipates. There's a natural dissipation to all that. Okay. Again, I'm on slide 3 and I've just summarized the whole talk. So all good. I'm happy. I'm just in good space. I'm always happy to connect with people. So I'm also trying to put this within the connection of, the context of what I call complete cancer care, complete kidney cancer care, or integrative oncology, which is that marriage between knowledge, the empowerment piece, medical system, and what you can do to empower yourself, right? It's the two together. And interestingly, anxiety taps into each of these, right? So there's the empowerment piece, body, mind, and spirit, essentially there. So I'm trying to say that you can still get the best care from the medical system and still work on the anxious feelings and the driving forces. You're empowering yourself all sides and using both logical mind, you're using your scientific brain, and you're also using the intuitive self. Something in you wants you to heal, wants you to grow, wants you to experience wholeness, right? And so there's that kind of capacity within yourself that's pushing this forward, which isn't kind of miraculous by itself, but it's the scientific, logical stuff. And it's like listening to your gut, listening to your heart. Yes, this is the right path for me. So it's the two sides together. Okay. This one I think is really important. And the reason I talk about setting of the intention is that if you're so busy doing what you should, I hate to use that word, or meant to, or whatever, doing the things that, open your heart, doing the things that bring you joy, doing the things that are important. And sometimes there are hard things you have to do as well, and it doesn't feel very good, but you're doing the right thing. If you're so busy focused there, it's much harder to tap into the fears. And so I think being deliberate about this, being conscious of this is important, because otherwise, what happens? You're going through your day and then something happens, somebody says something, into the medical points, these different things are happening, and you're getting pulled this way and that according to the winds of the external world, as opposed to saying, no, this is how I want to lead my life. This is how I want to, focus my priorities. And so that's why, for me, setting the intention is important. And I think about it going to, lots of different ways to kind of temporize this or chronologicalize it. It's as a ritual. So I like to do this first thing in the morning. My wife and I will practice a meditation technique. We use a biofeedback monitor. And then at the end of that, then I do my setting of the intention. And for me, what's most important from what I value personally is kindness to other people, compassion, being of service, being clear, being helpful. Like that, if my mind is there, my focus is there, then I think that's my best self, right? And so the days that I practice that visualization or the asking, sometimes it comes out in spiritual language, mostly secular language. Please let me be helpful. Let me be compassionate. Let me be clear. Please help me. So I'm saying a hard prayer, right? And then I let it go. And then, yes, I do good and bad, like I'm up and down throughout the day, but at least I've kind of set that subconscious routine for the rest of the day. And so I think that's important to do, both just like first thing in the morning or maybe reflection last thing at night, but also going into the difficult situations, right? You're about to walk into your medical appointment. Your doctor's about to chat with you. You're like clear thinking, well, what is it that I want as the end goal here? I want good care. I want to get my questions answered. I want to make sure I'm getting the best medical care in the circumstance. And so what do I need to do to be there? Well, obviously you bring a person along with you to help and all that stuff. However, you can kind of set yourself up to say, no, I'm going to be clear thinking in the circumstance. I'm going to advocate for myself. I'm the most important person in the room, not the physician. So you're like setting the intention, the attitude, the advocacy in that circumstance. So that's also a setting of the intention. And the last one is in the middle of the chaos. That's the hardest one to do, right? Because we all get caught up. We all get triggered. We all get stressed. We all get flustered. And then we forget. We're like stuck. We're like our thoughts have kind of masked us in the middle of the day. And so then how do you unmask? How do you kind of come back out again? And it's, if you can wake up in that moment and say, oh, I got caught. I'm really flustered. I'm really, stuck in my thoughts and my catastrophizing and everything that might happen badly, et cetera, et cetera. So, that's also an opportunity saying, okay, let's let that go and let's come back home to what's most important. How do I want to be in this world? So those are all these opportunities to do just that. Okay. On to the kind of nuts and bolts here. So at diagnosis, it's normal. It's expected. You're trying to figure out what treatments, don't know what's going to happen, uncertainty, stressful. Completion of treatment, I call it the post-treatment meltdown. You're suddenly sent back by yourself. The medical team's not watching you very much. Difficulty integration, family members, expectations. There's a lot of kind of unknowns there. Put it together, fear of what might happen in the future, plus uncertainty gives you those feelings of anxiety. Normal, expected. We humans are wired this way. We are the anxious species. So let's just deal with it. Like that's what's happening within you, this neurocircuitry within your brain. We don't have to say that it shouldn't be that way because it just is that way. We're a product of evolution. I want to give you a little bit of background around just this, there's lots of different types of anxiety. One of them is primed by the fear of recurrence. And that's the fear, worry that the cancer could come back, or if your cancer's there, it could get worse, right? So it's normal. That makes sense. Huge range, because I would expect everyone to have some. It's really the severe anxieties that I worry about. And that anxiety can pervade your life, right? It really affects what you're thinking about, how you're feeling, and then your actions. And I want to kind of reverse that. I want you to be able to experience the emotions, but decide how you want to act, what you want to do. You act despite feeling crappy. And those crappy ideas and feelings may be true in some sense, but you're still doing what's right for you. You're still connecting, you're still following your own values. So there's the big spectrum. And when you're really in crisis, there's the medical system. You want to tap into the experts, the social workers, the psychologists, to talking with somebody, your family physician, et cetera, et cetera. So when we feel anxious, and maybe even me talking about this right now is giving me some anxiety, that's okay. It's like normal. We just talk about it. Just because I'm talking about it doesn't mean it's going to happen, nor that your anxiety is going to worsen. In fact, I'm desensitizing you right now by talking about this. Like, we're living through this together. It's okay to experience some degree of anxiety. And so right now, again, instead of why am I feeling anxious, let's just do the quick scan. What does it feel like right now within your body, within your gut, within your heart, within your throat area, within your head? Is the right side of your body different than the left? Is the front different than the back? Just be very curious. It's like watching without labeling, without talking to yourself, without judging. It's like just experiencing. Okay, so you're also practicing mindfulness essentially right now, right? Just like very curious. Now I've just energized you. Almost all you would have got a kind of a, ooh, that's kind of weird. It's kind of fun. It's kind of different. There it is. You're energized yourself. You bring your consciousness into your body, and your body somehow gets primed by that. Okay, what is fear of recurrence? It's like a whale that moves into your living room. Over time, the whale gets smaller, but never quite goes away completely. A 10 you can't get rid of. Maybe it gets down to the size of a magazine rack, but once in a while you bump into it, and sometimes it swells up in your face again, like when you go for scans. I like this quote. It's obviously from somebody who has a cancer diagnosis. I like it because the whale is going to be there. Like the little elephant is in the room. It's like, it's okay. This is normal. And it's going to get bigger and smaller, bigger and smaller, bigger and smaller. That's us on our human journey. It's okay. We don't have to fight the reality of that. It goes up, it goes down. We still decide how we want to live our lives. The issue around that is that if fear of cancer recurrence gets a little too overwhelming, it can affect like multiple domains within your life. And this is kind of a bit of a description. So feeling alone, the feeling of anxiety, it's recurring, it's lasting for too long, can increase with time. It can impact, this is number one for me, impact on an individual's daily life, right? So I want you to live your full life no matter what's happening, right? So you may be quite frail. So within the context of the limit, you still change the game so that you can win. You can still love that next person who walks in the room, right? Whatever, you still have the empowerment. If you're watching this, you still have the empowerment to make a difference here. So lots of kind of features around that. How common is it? Most everybody. Yeah. So moderate and 50%. There's some vulnerable populations that we'll talk about as well. It's the 7% that I worry about. So it's the people that you're really kind of overwhelmed and it's taking you away from doing the things that you love to do. You can't make decisions because of that, et cetera, dominating your life. That's the time when you get the professional help. In the meantime, I'm going to talk about how to minimize the chances that you're going to be there. It is the number one unmet need if you have a cancer diagnosis. It's because it's hard to work with. It's hard to like just make it go away completely. So professionals and people who have cancer diagnosis suffer there. However, I'd also say that, post-pandemics, probably 1 in 3 of us are suffering from anxiety or depression anyways. That's probably older data that 1 in 3 cancer survivors at some point in their cancer journey have significant depression or anxiety, debilitating anxiety, right? Normal. It's okay. You can talk about it. It's not going to make it worse to be yourself. Talk about it. Thinking about different risk factors. If you're the type of person that, it's just a, ER type of character, type of, seeing the worst if you feel you can't help yourself or feeling less hopeful. And what I'm trying to do is also instill in you, you can make a difference. Let's change this. Let's flip this around and actually change your physiology, change your perspective. If you need to be reassured, talking to the physicians, who knows, male versus female, it might be just cultural in terms of people willing to admit to it. Younger age, definitely. If you're having physical symptoms, whether it's related to cancer itself or from treatment or other chronic conditions, that often increases anxiety by itself. And this is interesting. If you have less kind of understanding from an education perspective, it's harder to kind of flip this around. So again, I'm trying to educate you, empower you through all this. And then I just think about the social circumstance. And, again, an advice for you is have at least one person in your life that you can go to and you say to them, look, I don't want you to correct what's happening here. I don't want advice. I just want you to listen to me. Right. And then you can just be vulnerable. And I like that because you're setting up the conversation so that, you'll be heard in some sense. Right. So I would suggest if you can find some person in your life, and, the people at Kidney Cancer Canada can also act in that role. Right. So you can kind of connect with the experts on that side. So, yeah. So we humans, when we're feeling stressed within family, we're going to feel more anxiety. Okay. Now, I also think about triggers because it's like you might be able to just be able to see it coming, right? And say, okay, here it is. There it is. There's the pattern. It's like taking the kind of meta consciousness and watching yourself. The observer consciousness is watching. And part of the watching is understanding the loops, understanding the triggers. Right. So it might be the thought, oh, my cancer is going to come back. Right. So that could be the trigger that then goes, sets off a whole another cascade there. So again, if you have symptoms, side effects, and so on, could be events like the anniversary of your diagnosis on that particular day and when you're told at that particular time, or you had the big surgery day, could be the anniversary of that one. I would be very surprised if, almost everyone gets anxious around their cancer center visits, right? So going in, not knowing what's going to happen creates anxiety. Uncertainty creates anxiety. Add a little bit of fear into that one as well. And then even things that like famous people or friends or distant relatives, or, they get a diagnosis or, they're die of cancer. You hear about something on the news and that can also cause that trigger. Be able to watch it. Just be able to watch it. Start just with watching. It's so important. Okay. How about scanxiety? I'm not sure if you've heard this one. So it's the anxiety leading up to the scan or the blood test or the appointment to discuss the results. And then you can watch it. Again, watching, even right now, mindful of your body. Watch it right now. The week beforehand, probably you're seeing that kind of peak in anxiety, anxious there. Hopefully you get a good result. And then typically you walk away pretty high. So there's a pattern of every 3 months, anxiety and then good result. And then you're, feeling pretty happy. And then it kind of normalizes again till the next scan, right? So, and if you're more on the anxious side, it might be a buildup that's longer and a diminution that is longer as well. So again, watch the pattern without judgment, just watch the pattern there. Okay, the point is that there's more and more science around things you can do, interventions you can do that actually on average will decrease your anxiety, right? So yeah, because we're using the mind, using the perspective. And your mind is powerful. It's really, honestly, about perception. It's the perception of the circumstance. And you can take that even from the biggest spiritual level to be able to see yourself as beyond your thoughts, beyond your emotions, even beyond your body. It's kind of the biggest perspective. Cognitive reframing has to do with the thoughts. Oftentimes the thoughts are exaggerated or irrational, and that you can be realistic and think in a more positive way. It's not like just slapping on a happy face or, trying to be positive all the time. That's not it. It's like looking at reality and seeing a bigger picture and then empowering yourself and being kind. We'll go over at least one example there. The mindfulness techniques I've been talking about a little bit right now, right? In terms of allowing anxiety to be and just watch. Can you watch now? Can you watch the sensations in your body right now? Can you even watch your thoughts and not kind of identify with your thoughts, right? So you're building up that kind of skill, which actually helps again. And I like the acceptance and commitment therapy or training. I call it training as well. And essentially it's like, okay, thoughts, you can be there, but I'm still going to do what's most important for me, right? And I'm still going to live my life fully. And that's one of the mega principles of ACT. And I really like that as well, because it's, for me, it really humanizes it that we have these things are happening and we still go for what's most important. And then when you put your energy there, it's like these kind of fade away. It's like the little whale on the bookshelf. And then I'll touch this on that. The last one is, if you can really just go there and look at your fears directly, probably through professional help is probably the best way to go out, unless you've got a kind of capacity to hold. I think, this is also very helpful because it really diminishes the power of fear over you. When you can just say, okay, well, that's what I'm fearful of. And look at all the worst case scenarios. Okay, I can deal with that. That's fine. My resilience will match in that circumstance. And ultimately the reframe is, it's like having death sit on your shoulder, because it allows you to understand that life is very precious. Whether you got another 2 years to go or 52 years to go, it's like very, very precious. So the flip side of going deep into the darkness is to recognize that you have the inherent light. And I've seen that a lot in the weekend retreats that I've facilitated. Okay, so now let's get very practical. How can you minimize your fear of recurrence by being practical? So you ask your doctor so that you have the information, even if the information is information you don't quite want to know, that's better than the unknown. It's better to just deal with the truth. If you can see it clearly, and if you don't want to do that, that's okay. It's not everybody that can do this. Maybe a relative or friend can be the one who kind of keeps the bigger tab there. What's the timing? You may have a very, very slow growing cancer. Even if it's incurable, if it's coming back so slowly, so many years in between recurrences, that, you're likely to die of something else. So it's like having that conversation with your physician. Again, take the murkiness out of it. Think of it clearly. You will, even if it's difficult, it's like the psyche repairs itself. It's like, if you hear too much, it's like, whoosh, it kind of gets sealed over. This is the key one. How would it come back? And I'll show you on the next slide why that's important. Is there anything I can do to reduce the risk? Which is this whole darn talk anyways, the whole Cancer PEP program. It's like, how can you maximize immune function? How can you be in the best psychological state? There's no guarantees here, but you're doing everything that you can do. And then ultimately stop trying to control everything. You can't. It's just like, let go of that and just like, okay, I'm doing the things I can do. I'm advocating for myself. I'm getting the best medical care, body, mind, spirit empowerment. I'm living my life fully. Okay, there it is. Then I just keep on powering myself that way. And no matter what happens, you've done everything. There's no regrets at that point. Okay, this one I think is important, right? So understanding the signs of recurrence, because if you're worrying about stuff that is not cancer, then you're causing yourself stress unnecessarily, right? So if you get the flu or you get diarrhea for whatever, some bad food, or you got some arthritis, you don't have to think it's cancer in your bone every time your arthritis flares, right? So you're understanding what is cancer, what is not cancer. So typically I would say that if you have a pain that's constant, progressive, and severe, that would be like a cancer type of pain that you need like major painkillers for, right? So that would be a pain that I would worry about, for instance. Or if you're like totally wiped out, you can't do anything. Again, those are the overwhelming symptoms, not just the I'm tired from all the treatment and the stress in my life, but the big stuff. Okay, I want to talk about creating the conditions for you when you'll be less anxious. And so from an evolutionary perspective, I use the hand model of the brain. The wrist is the spinal cord, the base of the thumb is the reptilian brain, the first level of the evolutionary development. This is the fight or flight, the withdrawal from danger. And then the next level of the house that was built is the thumb, which I call the limbic system. I call it the irritable brain. It's the reward seeking system. And then next level of evolution through a very much our human side is the kind of cortex frontal lobe. That's where you want your neurons to fire all the time. You want to be engaged in your frontal lobe because that's the best version of you. Your best version of you lives there. It's also more creative. It can, more moral. Has better solutions. It's more logical. It's the smarter you. And when you're stressed, you flip your lid essentially, and you disengage from your frontal lobe and you're working out of your irritable stress brain. And this one doesn't think very clearly, right? And so all day long, we're going back and forth, stress, okay, clear thinking, stress, back and forth. So the idea is to be spend more of your time here. Interestingly, how it sets up, the frontal lobe overlies the irritable brain. It dampens, it actually sends signals back to the brain. It says, don't worry there, little scared guy, we're actually okay, right? And so, and then you can actually, this is where you get to choose how you want to live your life as well. So how do we stay there more often? And the same, when you're living out of your frontal lobe, the same stresses are happening, but you're much less likely to lose it. And you're much better at kind of coming back home again, right? So the idea is to set that up so that you do that more often. So we're flipping back and forth between those two sides. So we set up the conditions and we return home when we've lost it. Those are the two kind of parts of it. And this is the motherhood stuff that you probably know about. I'd ask you right now, whether this is live or you're just watching it as video, I'd ask you to actually stand up in this moment. So there's something called sedentarism. And you want to maybe look away. Do I have my shorts on? Just got my nice top and my shorts going. But anyways, so you're looking up, stretching away from the screen. Yeah, 5 minutes on the hour. That physical motion by itself stops you from kind of physically contracting down. You want that kind of sense of openness. So we exercise, we do strength training, we get up 5 minutes on the hour. Diet. When the sugars spike and the insulin system tries to get the sugar into the blood, your sugars are going too high and too low. Both of those states don't allow your brain to work as well. You want to take care of your brain, feed your brain with healthy foods, especially plant-based diet. Time-restricted eating means not eating for many hours during the night. That's probably 12 to 14 hours, and you can train yourself to do that. It's I'd have to have another 15 minutes just to go into each and every one of these more clearly. To think about time restricted eating, sometimes people call it intermittent fasting. Not eating during that time allows your brain to kind of heal itself. It has an anti-cancer effect. There's a lot of positive stuff happening if you actually don't eat for a while, get yourself into ketosis. The sleeping piece, again, facilitating a better night's sleep is important. Practicing a relaxation technique. Again, when you're practicing relaxation, you're innervating the left prefrontal lobe, which is associated with the happier part. Your frontal lobe gets stronger by practicing that relaxation meditation, however you want to do that. Do the things that nourish your soul, right? You're focusing there, get into nature. And then my wife had to teach me this one. It's touch. The oxytocin that's released when you touch yourself and when you connect with others is also settles down that monkey or resets the stressometer in your system. And then the other side of it is don't watch horror films because it's not good for you because you will feel upset. And I don't like to watch television news, the visual stuff, because I'm too sensitive. I like to listen to the radio so I know what's happening in the world. Just try to eliminate the unnecessary stuff. I think social media has its place when you are connecting one-to-one with another person, but that kind of scrolling, all that stuff in comparison, it's not good for you. Anyways, that's me preaching. Avoid the alcohol and so on. So mindfulness is really good, right? So what we're talking about is when the stresses come up, we become mindful. We watch carefully what's happening there. So how do you experience when you're suddenly stressed and overwhelmed? I'm going to flip through these more quickly though. is we all have a stress signature. So when we're scared, what can happen? The heart's pounding, the breathing, the jaws, the sweaty palms, the acid stomach. It's like all sorts of stuff can be the cues to say, oh, I'm in the middle of a stress reaction. Emotionally, sometimes it's just the fluster, it's the anger, it's the seeing red, it's the feeling like I'm going to cry. It's like the dissociation can be the cue that says, oh, I'm feeling stressed. Sometimes it's how you think, not what you think, but how you think. Oftentimes, if you're like, feeling stressed, it's this part of the brain that can't think clearly. So you get the foggy feeling, or you get very fixated, hamster wheel, same thoughts going around. What you think. So one of the things that I notice is if I'm swearing in my mind, then that's an automatic cue. It's like, oh, I've really wound myself up here, haven't I? Right? Or blaming, pointing the fingers at others, calling them names, calling yourself a name. I'm such an idiot, blah, blah, blah. So all those things. And when you're like, what do you do? First thing, try to let go of the thoughts, practicing a relaxation technique or pretending to be relaxed, remembering what it's like to feel good. And I'll just take you through this very briefly, this kind of, and you can actually do this with me right now. So you notice that, stressed, press the pause button, because 99% of the time you don't have to snatch a child from underneath the car. It's the thoughts that are driving your anxiety. So when just let, the thoughts are going to be there. The information is going to be there. You can tap that in later. For now, you're going to settle yourself down. Press the pause button. Mindfulness. We've been doing this all along now. What does it feel like physically in your body right now? Do this with me right now. Watch. What does it feel like? What do you see? What do you feel? What do you experience? Without thinking it, experience it. Okay? Next. Long, slow, smooth out breath. Breathe in. Long, slow, smooth out breath. Watch mindfully. Breathe in. Long, slow, smooth out breath. Be mindful. Watch carefully. Again, breathe in. Long, slow, smooth out breath. You do the longer, slower out breath because it actually primes your brain to feel like it's in the relaxation mode. And then you can actually tap into the frontal lobe that will be the kind and rational self that says, relax, it's okay. We'll take this one step at a time. You've been through this before. You can do this, right? And so then you reassure yourself. So that's in the moment type thing. I'm going to tell you to practice this. 10 minutes a day even have been shown to kind of change that neurocircuitry. It's using the activities where you're letting go of the kind of chattering mind and bringing your attention back to something. And yes, it goes back and forth. You're not going to do this perfectly, but you practice that with a longer, slower, smoother out breath, and you actually change your physiology. So it's very important. One of the empowerment parts of this, improve immune function, et cetera, et cetera. I'm just going to tap in very quickly to Judd Brewer, fantastic clinician, psychiatrist, neuroscientist, wrote this great book. And essentially, we're talking about habits which have their evolutionary advantage. So you learn from making mistakes, like you almost get hit by a car, you remember to pay attention. There's these loops, right? The trigger, the behavior, the reward from an evolutionary perspective. Out in the savannah, you see those berries, you eat the berries, as action, result is you feel satisfied. And the system, the dopamine system is set up so you remember that. Unfortunately, we use the same system when we're stressed. So we're feeling stressed. Oh, I've browsed the internet before. That's made me feel better. Okay, I'll just browse the internet. The problem is that's distracting yourself, and you may not want to actually just browse the internet. And that may not be what's most important to you, right? And you may lose the opportunity to keep there. To learn from that. So the frontal lobe, the problem is we can't rely on our frontal lobes always being engaged, because there's time when we're tired or hungry or panicked or overwhelmed. We're going to be like this. So how do we work with that? Habit loops. So I wanted to kind of talk about a couple of habit loops. One is you feel stressed and then you distract yourself. And the distraction may come out as a behavior that's not healthy, like eating ice cream or, too much internet or, binging on Netflix. I mean, by themselves, they're not bad things, but too much of any one of those is not so good. So, and then you lose the opportunity to reframe. The other one is you can become avoidant of that circumstance, and then you don't go to your doctor's appointment. And lastly, the habit can be worrying. I want you to hear me now. Listen to me now. You can have a habit of worrying. You're feeling stressed and then you worry because you think the worrying is actually going to help you feel better. You feel like you're doing something, but you might just be priming the wheel of more stress. Worrying is typically not helpful. It has its place to understand what you can and can't do, but that is a habit loop of worrying that you could reframe possibly. So I just wanted to give you that opportunity. It's almost like I'm giving you a little smorgasbord and you tap into the ideas that are best for you. So how do we do this? Mindfulness is the start there. You watch yourself, you understand your habit loops, the triggers, the behaviors, the results of that. And then part of it is to be able to live with it, different ways of actually reframing or resetting those habit loops, create the better reward. Okay, I'm just going to take you through a quick idea that you can reframe difficult thoughts. This is cognitive behavior theory based on David Burns' materials. He's written a recent book as well, Feeling Great, I think is the name of his most recent book. But essentially, it's the idea that our thoughts influence our emotions. So for instance, if you say to yourself, I'm useless, I'm such an idiot, that often will lead to a depression. And if you can reframe, like the reframe from that would be is we all have intrinsic beauty and strength, which is actually true. That will mean that you'll have less depression, or it'd be easier to get out of depression, right? So the thoughts are creating that. So you can change the way your mind thinks. You can change your perception of the world, which will change your emotions, which change your activities. It's like, it's all possible because it's based on the core beliefs that we have. This is the 3-step process. So we have a situation, which is the raw reality. Oftentimes we have the distressing thought that primes and causes more distress that's unnecessary. If we can see that, we can go to the second column of awareness. And lastly, the kind and rational response, which comes out of your frontal lobe, which is to be able to acknowledge and be kind to yourself, see a bigger perspective, and so on. So, okay, so here's the situation. So a famous person gets a relapse of a kidney cancer, right? So you hear this on the news, oh, Joe got this. And then you think to yourself, if that person's cancer came back, it's going to happen to me. And if you believe that, if you start to kind of follow that path, then you're going to feel depressed and despaired, and your immune function goes down, and it's not helpful. And it's exaggerated because you just don't know actually what's going to happen in the future. So you've created a fortune teller problem. So we use a reframe, acknowledging, looking at a bigger perspective, and encouraging yourself. So how would that sound? It might be like, yes, it is scary, but the fact is I don't know what's going to happen in the future, and worrying is not going to help. Instead, I can choose to live my best life right now, right? So this is just a quick example, and there's lots of different ways of doing reframing. I have to be the strong one. It's best to be honest with each other, etc. So anyways, we won't go there. Looking at fears directly is powerful, maybe within the context of professionals, and then kind of beating up on yourself, that kind of second arrow type thing. And self-compassion is the way to kind of just say, okay, that's how I feel, and I'm going to move forward there. What's your relationship towards anxiety? Do you see like, this is awful stress, I need to avoid this? Or do you say, this should be accepted? My anxiety means that something important is at stake, right? So it's this differing perspective. Here's an opportunity to learn, or the way I say it is, I can always get stronger from this. I can always learn from this. And so you always have that opportunity to go on that side. I won't give the hands of thought metaphor. It's just maybe the idea is that if we get caught in our thoughts, then we can't actually see what's happening around us and appreciate our life and do the things that we need to do. And there are lots of ways to understand that those are just thoughts, right? I'm having the thought that I can't cope, or I'm noticing I'm having a thought that I can't cope, right? So the can't cope is just like a made up concept. Thank you, mind, for that thought. Thought balloon leaves in the stream. Aha, there's that old I can't cope story. Again, we're just being able to watch yourself and recognize that there's part of our mind that's going to create that narrative that isn't actually true. Okay, so I'm going to finish with a 1-minute pitch of our Cancer PEP program. Colleen mentioned it. For every day for 6 months, we're going to send you an email saying, this is what you need to do today, and kind of teaching you and encouraging myself in oncology, my wife, psychology prof. And we it's basically everything possible that we could kind of fit into a program to teach you to empower yourself. So we have these little videos each day that kind of are fun and teach, but there's strength training, dietary advice. We talk about sleep. It's like stress reduction, relationships. It's the whole system, that opportunity to set you up in a buddy system. You go there by going to cancerpep.org. And that on that website is a 10-minute video and explains the program. And I'll stop. Look at that, Christine. 50 minutes on the dot.
Perfect timing, Rob.
Very happy to have questions there. I'll stop share screen so that people can ask questions verbally, but please reach out, cancerpep.org.
Yeah, and I do want to put in a plug for that. Actually, I was checking out some of our attendees, and I see that there are a few of my fellow Cancer PEP people in the audience, so they certainly will attest. We have regular coffee chats, and we kind of edge it in there, and we have a few more that want to join in. So it really is a great program. I told Rob that I'm a remedial student, but he was very kind and said, don't worry.
Yeah.
Just like our talk today.
Yes.
Don't worry. Just little, tiny steps. And it really does make a difference when you allow yourself to think and feel like that. Yeah. It makes a huge difference. Now, here I am chatting away, but we do have some questions.
Go for it.
And I see Cassian has very kindly said that you can raise your hand. I can't see everyone, but I think Mona and Cassian can look after us. But it says, how would you define stress versus anxiety?
Stress is that kind of sense that you can't cope with the situation. Like there's the external circumstance is bigger than what you think you have your intrinsic resources. So that's kind of that differential. Whereas that anxiety is more like a feeling of, it's that kind of uncomfortable feeling of fear. Like it's like fear and uncertainty together. It's like I need to do something. Something's pushing me to, I got to do something. So yes, I guess there's slight differences on that side, but anxiety is more of the kind of emotional response to probably a stressful situation.
But would you feel kind of physical symptoms then with anxiety more so than stress, or do you think it's pretty even?
Yeah, do you know what? It's really interesting because fear is one of the primers to a stress reaction. Whenever we're threatened in some sense. So yeah, I guess it's all part of the same spectrum of that. And when we hear stress, like there's different definitions of it in some sense. Of people here, I have a stressful life, like I'm too busy. That's not really stress. Stress is actually a physiological response to a demand of the circumstance. So stress has a physical, like the heart, the breathing, all that stuff that I'm going to. It has a psychological aspect, emotional aspect of it as well. So it's like it's the physical, it's the body's reaction is actually a stress reaction. Right. Anxiety is an emotion. Yeah.
Okay. Heather brought up a great point. She's asking if anyone can access this. This webinar with Dr. Rutledge will be posted on our website so that you can certainly go back, because Rob, you gave so many good tips. Like it's too hard for us to remember. Like I love the hand analogy, you know, like that was really good.
Yeah.
And I noticed, just kind of going through, I noticed a couple of points. Naps, are they okay? Like you said, sleep, we have to be careful with our sleep. Some people try to avoid naps because then they think it might disrupt their sleep later. What do you think about that?
I'm a professional napper, so you might get a biased perspective. The science shows that if you nap, and I'm going to tell you the kind of conditions around that, after you wake up in the afternoon, your like verbal memory is better, some physical learning memories are better, your blood pressure is down. So there's some physical benefits. And I also have seen that napping this afternoon will allow me to get a better night's sleep tonight and wake up more refreshed tomorrow morning. So, however, here's the caveats. It has to be early enough in the day. So, definitely before 5 p.m., better probably before 2 p.m. in that range, probably shorter. And for me, it's if I can just get a little bit of REM sleep, it really kind of like changes the chemistry within my brain. It is a skill. And it's also, I would say for everybody, like you test that out within your life and see if it actually works for you. So, yeah.
Okay, that's a good fizz. And the one that has really honestly benefited me, I set my watch now. I have an alarm on my watch, 5 minutes, stand 5 minutes every hour. It makes a huge difference through the day. And just in general, I've found that it's made a huge difference, physically in my life. And I strongly recommend it to everybody. What did you say? I think you've told us before that sitting is the new smoking.
Yes.
I think it was you that mentioned that.
Yes.
And
yes.
So we really do have to be careful.
Yeah. 5 minutes on the hour. So for the cancer pet people, we kept pushing it for 6 months. We kept going.
Yes.
5 minutes on the hour.
Well, I am going to read what Wendy mentioned because I'm not sure if everyone can see it. She does love Cancer Pep. She highly recommends it to anyone. It really helps her deal with her anxiety related to cancer. And, we all, well, not all of us, some of us have real difficulty in facing it with our families.
Yeah.
And, talking about it with our families, even admitting it to our families. And I'm just reading what she said.
Yeah.
What she used to do and really want to do are kind of two different things.
Right.
But it really helps with everything. Maybe you could touch on that a little bit.
Yeah. No.
How do we talk to our family? Like, give us a key.
Yeah. So I think like what I'm coming to my own mind is that you need to choose who the characters are within your group, whether it's your family members or your friends, who can actually really be truly supportive, because some people just don't have the capacity and, just to be able to open your heart and just say, okay, well, that's where that person is in their life. They're doing the best that they can. I'm doing the best that I can, but they're not going to be able to kind of hear me out in some sense. And so, so it's like, one is make sure you have at least that one person or a couple people where you can be open and vulnerable with them. So that's, even if it's not your spouse can't do it for you, please find somebody else to do it. And secondly, it's like your health is like super important, and being guilty about not doing it perfectly is just not worth it. So I would just, in some sense, just try to let go of any sense of guilt and just say, look, we're all doing the best that we can.
Perfect.
Yeah.
Yeah. And I have the perfect answer for number one.
Go for it.
We are here to help. At Kidney Cancer Canada, we're here to help. If you want to talk one-on-one, we have our peer support program. We have our coffee chats. And I have to tell you, they are like family to me now. We have a lot of regulars that come. It's open conversation. We really care about each other. We have, I learn something new every time. So if you haven't joined our coffee chats, please do. It may not be for you and you don't have to come back again, but give it a try.
Try. Smart.
I have a couple of more.
Can I just add one more point? Because I finally got to read
yes, please.
Wendy's complete question there. So it's this idea that I can't do as much as I want to do.
Yes.
I feel responsible. I've been the one who's kind of taking care of other people. I've been the breadwinner or the house, cooker, whatever it is. We need to recognize that we only have so much energy every day. And it's better. In fact, this is the flip is if you make sure you stay within your limits, you'll stay at a higher functioning level for a longer period of time. If you try to overserve other people, you'll crash more quickly and ultimately you won't be able to help as much as you could. So staying within your limits is actually the highest function. And so you shouldn't feel guilty about staying within your limits. Yeah.
And that's really important to stay healthy.
Yes.
And you want to be healthy.
Yes. Ultimately,
right?
You're actually more functional and more helpful if you stay within limits and say no. Saying no is a very powerful thing to do and maintain yourself within those limits. And
yes, it is. It's very hard no. and harder for women.
Yes, great. And then I'm just going to tell you the joke around this. There's 3 phases to saying no. You open your mouth, you say no, and then you close your mouth. And anyways, I'm just teasing because I know that on 3rd phase, I'm trying to promise something else. So anyways.
Right. I'll come back to Kim's question in a second. Do any psychologists specialize in counseling for this kind of anxiety?
Yes, 100%. So there are the new techniques around fear of recurrence and anxiety, and chat with your cancer center team and get referred to the right person if that's really an issue for you. Yeah,
they usually do have someone within the cancer hospital or clinic, so they can refer you there. Make sure you talk to them.
And I really so endorse that for anybody. Go and see the counselors, see the specialists. Even an hour can be extremely powerful in terms of making that shift in perspective and learning those skills that can make a difference.
For sure. And Kim asked, Cancer PEP is a 6-month program, and they're both still working. It might be difficult to commit to daily. What happens if we join and fall behind? Guilty.
It's okay. We recognize that people have busy lives and sometimes it becomes extremely busy. And this is a flexible program. So we're making kind of suggestions every day as to what you can do to kind of, feel better, stronger, et cetera, et cetera. But it's not meant to be a stress. It's not like Big Brother's going to, knock at your door and say, I'm sorry, you didn't meditate for 10 minutes per day, that type of thing. So really, you do it in a way that makes sense within your lifestyle.
And it really is easy to integrate into, your life and your daily living. I work full time and have family, and you just find the little moments and you try and integrate it into, your exercise and your meditation. And it's not hard, and it's better to try than not do anything at all, for sure.
Yeah. And you ultimately will have more energy. You'll be you'll have greater function. It seems paradoxical. I'm too tired to exercise, but actually if you exercise, then you'll have more energy. So anyways,
Right. Okay, that's great. Well, it's come to the end, and it's been such a great talk. I think you've given us so many points and ideas on how we can manage our stress and anxiety. And I'm so grateful to you for coming and joining us and offering this. As I mentioned, this will be on our website. Give us a little time to pull it all together, but it will be posted on our website. And then you can refer back and get the points that you missed. Thanks for the 2 books. They will be mentioned on our website as well, in case somebody wants to. I recommend another book that I know Dr. Rutledge offers to his patients and the Cancer PEP group is Tiny Habits. Yes. And I bought that, and it was very helpful. So that's another good book. We'll put it on the website as well. If your question didn't get answered tonight, please send it to www.kidneycancercanada.ca, and we will do our best to make sure that the question gets answered. And if it's specific for Dr. Rutledge, then we can pass it on and he can give us the right answer. So I'm so grateful that you all joined us this evening. I hope you got something out of it. I know that I did. And we'll look forward to our next webinar. And Dr. Rao, I'll look forward to seeing you next time.
Take care.
Take care. Thanks, everyone.
Everybody. Blessings.